We are a family-run business. We have 12 pharmacies in and around London. In the current climate, we wanted to maximize on patient needs, so technology was a key aspect of that. The challenges before MDS automation, where we were doing 1,000 manual MDS patients for the whole group. Teams were reluctant on taking on extra MDS patients. We were finding the workload to be too much. The reason we switched to automation was due to the increased workforce pressure and the increase of dispensing costs. I spoke to people in the industry and they highly recommended Omnicell.
So the key areas that we had a lot of support from Omnicell was initially from site selection. So we had a number of branches that we thought of housing the hub in, and they helped us pick the right one. We also had help with training throughout the process, so our teams were able to get trained and be comfortable with using the VBM from the outset. And then also with liaising with our PMR provider, ProScript, Omnicell liaised with them to get an interface between our hub and spoke branches to ensure that data transferred between them easily. When we went live, we had 8 days of training with Omnicell. They had a trainer on site, and we actually effectively went live in that time. So we started off with a couple of branches, and by the end of the 8 days, we'd actually onboarded all of our branches of the 12. And we started off in the first month doing around about 157 trays in the day. Then it went to 287 in the second month. And then at month 3, our record has been 406 trays for the day, which is effectively about 100 patients for that day, which is amazing. And we're really pleased with those results.
We've seen time saved on dispensing and checking. The machine does about 40 trays per hour. That would actually take, if someone had to do it manually, about a whole day. The staff morale has improved, so we were able to upskill our staff in other areas of our business. We have made savings on workforce costs, which have been able to support the staff in looking at other avenues of the business to generate more income.
We're now in a process where we've onboarded all our branches. Work is flowing nicely between branches and also the hub, and we're able to cater for the entire 1,000 patients that we have from this hub.